Learning new medical skills is not a game. The challenges are serious and the results affect a human life. For some, there are no second chances. Today's healthcare industry faces unprecedented challenges. Hospitals need to update traditional training methods and deal with technological advances and personnel shortages. Patient safety, costs, time demands, and increasing skill requirements are forcing the medical industry to examine new and better methods of learning and demonstrating competency. The most advanced method of training, realistic cognitive training, is now available from Medical Simulation Corporation. MSC systems are a response to a request from the medical community for help training people and evaluating new products and procedures.
You need to realize that the technology changes rapidly. We've had enormous changes in the 20 or 25 years since the introduction of balloon coronary angioplasty. We have now whole hosts of new devices for making new blood vessels, for encouraging the development of new blood vessel growth, as well as other technologies that we in the medical interventional field will need to learn how to use so that we can optimize the outcome of patients. And so from the standpoint of training, I think this is going to be incredibly important technology to develop and to bring along.
With the risks so high, up-to-date information and constant education is a must for ensuring competency. MSC's Tactile Force Field Simulator allows medical personnel to learn new skills and to update and practice their current skills in a real patient environment.
Today we're going to simulate a coronary intervention in the cardiac catheterization laboratory. And the key elements to that simulation include, first of all, a tactile simulation. That is, what I'm doing down here has a very important tactile element. Secondly, a visual element in terms of what I do here changes things on the X-ray screen. Also, we can do puffs to see the X-ray contrast material going through the coronary artery and showing us where the blockages are. And then we're simulating also the patient's condition with an electrocardiogram and a waveform of blood pressure that we can watch beat by beat. And so we're obviously also simulating the whole team approach in that these interventions are done by a group of individuals. Each person has a respective role. With a puff, I can outline the lumen of the artery and then steer going down. Puff again. Now I'm going to take the stent delivery system and advance that, watching my guide wire position. Puff again. That looks like a good position. Do you think so?
I believe it is.
All right. Why don't you inflate and tell us what you're going to inflate to?
Stent positioned in mid-vessel, first inflation.
And we're going to go up to 14 atmospheres for 30 seconds.
14 for 30.
So now we're implanting the stent into the coronary artery in the location that we have chosen as the appropriate. And we're monitoring the patient's condition, looking for the ST elevation.
Slight increase in chest pain, 3 out of 10.
Deflating balloon.
And now what I'm going to do is withdraw the delivery system and puff. And we have a stent now implanted. It looks good, so guide wire back into the guiding catheter.
Guide wire removed.
Puff. And another view, please. Puff. And we have a successful procedure. So we've simulated the deployment of a stent in a coronary artery.
Gaining an experience and a comfort level with the technology prior to using it is essential. And I think to that extent, simulation provides an enormous benefit in the fact that you can get your hands-on experience with this device prior to taking care of patients. And by doing that, you can walk into the catheterization laboratory or the surgical suite with an experience and a confidence level that you've seen a lot of the possible subtleties or issues that may arise during a case.
Leading physicians and medical institutions recognize that an efficient training method results in superior, consistent quality of care and lowers medical costs. As MSC grows through the creation of regional training centers, industry alliances, and the establishment of a global network, its goals remain simple. Train physicians, nurses, and teams of healthcare professionals as quickly, efficiently, and safely as possible. Medical Simulation Corporation is setting the standard in cognitive educational training and services for the worldwide healthcare community.